Okay, Oluwakemi, please you can go ahead. We're live now.
Hello, everyone. Good evening. How are you doing? And how was your day? My name is Lashe Bikolu Rachel, and I will be the moderator for today's webinar. So we appreciate you for joining us to celebrate the World Physiotherapy Day 2024 today, and I wish you a happy World Physiotherapy Day. So the theme for this year's World Physiotherapy Day says low back pain, and then it's a very common condition. Low back pain is a very common condition affecting millions of people. And then the pain varies from mild discomfort to severe pain that is even affecting activities of daily living. And the role of physiotherapy and the role physiotherapy plays in the management of this role can never be overestimated because they use several modalities, exercises, therapeutic positioning, massage, mobilization, even postural education to help patients to improve their quality of life and to improve their well-being. So the activities, the role physiotherapy play in improving the health of patients can never be overestimated. And then, in the view of this, we have with us a very, very wonderful speaker. He's a vibrant, phenomenal, young, and amazing person. And then his move and his drive in this world of physiotherapy can never be overestimated. He isn't just a physiotherapist, he's a mentor, he's a coach, he's a life coach. And I will tell you that he's a source that you will always have something to learn from. PT Chijioke Optikpa, thank you very much for being available with us. Really appreciate your presence, sir. And I would like to also appreciate everyone present here today, everybody from IFUTSA and then beyond. Thank you very much for joining us as we celebrate the World Physiotherapy Day 2024. So before starting proper, I would like to invite my president and the person of Ahmed Awal for our welcome address.
All right. Good evening, everyone. As Eda mentioned, my name is Hawa Ahmed, the president of Ife University Physiotherapy and Occupational Therapy Students Association, as IFUTSA. And I'd like to specially acknowledge and welcome everyone here today, within and beyond IFUTSA, because this thing was made public just so that we could reach a wide number of people to gain from this. As we know, it's September 8th, World Physiotherapy Day, and we're here to celebrate our noble profession. Like, I woke up this morning pumped up with this energy, and it's because I'm like damn proud of this profession, and it should be too. Physiotherapy is like a noble profession, one that uses Midas touch to create something that is considered as magic. And I saw something somewhere that says doctors save life, but physiotherapists add meaning to life. And yes, we help to restore function and improve the quality of life. Physiotherapists change limitations into possibilities. We are the compass that add patients back to wellness. And also, in physiotherapy, our hands speak the language of healing. And this is worth celebrating because, come on, we remain the beacon of hope. And you are here today because you are here to gain value. Because we never stop learning here. And with that, I'm acknowledging everyone here within and outside the FUTSA from every group that you got this link joining. You are welcome. We are glad to have you here. And trust me, our speaker is someone that I consider a force in the physiotherapy profession. You shouldn't just be here to listen, but you should be here to learn. And learning entails making sure that you write down something. You'll be here, something that you have to look back to, and then have an evidence to say that you're actually here for this webinar. And I don't know the number of IFU sites we have here present. I believe some people are still joining. But then to IFU sites that are here on this platform, I would want us to do something real quick. We should go to the general page and then just post with the fire emoji. If you are not here, you are missing. Note, there are giveaways and it will be based on random selection. So we don't know what we use to choose our winners, but then just make sure you go to the general page and type, if you are not here, you are missing, because I want a large number of people to gain from this. It's a webinar organized for all physiotherapy students within and beyond. So yeah, kindly do that. And then please make sure you follow the page of our speaker. You are here to gain value, not just now, but support after the session ends. Once again, welcome to IFUTSA First Official Program for this administration. Do put your pens and your jotters to use and enjoy this session with us. Thank you very much for joining. Now over to Kemi.
Thank you very much, Madam President. That was a very, very nice, amazing address. And as she has said, this is not just a session, it's a session like no other. Get pumped up, get prepared, get your pens, get your book, and get ready to learn and learn and learn a lot. You're going to learn a lot of things, unlearn and relearn lots of things because I tell you, our guest speaker is very, very prepared for us. He's pumped up and is ready to supply us a lot of things. So, briefly, I'll be reading the citation of our guest speaker, PT Chijoke Otikpa. He is popularly known as, kindly let me put the citation up for us to see. He is popularly known as Coach CJ, and he is a certified physiotherapist who graduated from the Nnamdi Azikiwe University. He demonstrated sound clinical competence in his undergraduate days by receiving the Dean's Award for the Best Clinical Student upon graduation. Aside being a physiotherapist, he is also a multi-time award-winning CBT life coach, corporate trainer, and public speaker, certified by Transformation Academy, United States of America. Coach CJ is a first aid and basic life support practitioner, trained and licensed by the National Healthcare Provider Solution and Postgraduate Institute of Medicine. He has been hosted as a guest speaker by big brands and reputable projects like the NTA, Nigerian Democracy Radio, Radio Nigeria, West African Democracy Radio, Health Accelerator Africa, The Bose FM, Shikan Nigeria, HICP, Global Education, Ambassador Program, Nigerian Medical Student Association, NIMSA, The Things Matter by USAID, to mention a few. Feel free to reach out to him for collaborations and mentorship. He is very, very much prepared for us, and I am telling you, you are going to really, really learn from this program. So join me as I welcome Chijoke Otikpa, popularly known as Coach CJ.
Okay, thank you very much. Okay. Let me see fire emojis. Let me see the fire emojis. If you're a physiotherapist or you are a physio student, you can put PT alongside your own fire emoji. If you're an audience, you can just put, you are coming in, you are not a physio, you are anybody else, but you love physiotherapy or you want to learn more about physiotherapy, still put the fire emojis and, just leave the fire like that. Okay. As many fire emojis as you can put in. If you burn down the house, Hawa is wealthy, should build another one. Okay. So yeah, we are here today to celebrate World Physiotherapy Day. World Physiotherapy Day. And we're going to be having a focused discussion on low back pain. Low back pain. And I'm going to be doing a lot of dissecting what low back pain is about. Okay. And just in case you feel like, oh, this is not for me, I'm still young, I'm not old, I still have a lot of years to go. I'm not old, I'm not married, and this is not age selective, it's not age specific. We've had children experience low back pain. We've had adolescents. We've seen adults. We've seen old people. Elderly people experience low back pain. Okay. So as much as possible, you have to pay attention because this concerns you. Even if you've not experienced it, even if you're not experiencing it currently, you still need the information. Even if you are not going to experience it, maybe you are among the 10 to 5% who may not have experienced it or may not experience it in their lifetime, but then you will have people around you who they are either experiencing low back pain or they have experienced low back pain that really affected their lives. And you may be the one to give them the right information. And that right information begins by knowing what you need to do even now. Okay. So let me see. Okay, okay, I could see your comments. So I was thinking it was here. You're all welcome. You're all welcome. Everyone who is coming, you're welcome. You're welcome. Absolutely welcome. And I'm going to be pulling up some videos up on the stage so you can watch and enjoy with me. Then occasionally I'll also pull up some images. I think I can control that from here. So um let me start with this. Let me start with this video. Okay, just watch with me. I hope you can hear the audio when it's playing. Let me start with this video. Okay, okay. I don't think that started from.
Happy World Physiotherapy Day! Happy World Physiotherapy Day! Happy World Physiotherapy Day. This year, the focus is on low back pain. Low back pain is a leading cause of disability, affecting millions of people worldwide each year.
Over 90% of low back pain is not due to a serious or specific underlying disease.
It can be experienced at any age. Fun fact, not so fun fact, it will affect almost everyone at some point in the course of their lifetime. However, it only becomes chronic, that is, lasting more than 3 months, only in a few cases.
Rehabilitation is important for every stage or type of this condition.
Remaining active and exercising regularly is important and essential for prevention or recovery. Physiotherapists are specialists in the care of low back pain and can offer tailored and supervised exercise programs. So what are you waiting for? See a physiotherapist today.
Okay, okay. Absolutely, absolutely nice. I just wanted us to watch that video to get, some insight of what physiotherapy is about. And I'll give you a background here. I'll give it. I'm going to take you off from stage and I'll bring you back. Kemi, I'll take you off from stage, but I'll bring you back. Yes, I'll bring you back later on. So good. Um, please don't leave me. I'll bring you back. Now, like I was saying, we have to understand what physiotherapy is all about. Physiotherapy is a healthcare profession laden with the responsibility of helping people get better holistically. But the basis of it is pain, eliminating pain or alleviating pain. And usually it's musculoskeletal pain, nerve related pain, you know. Secondly, anything that requires exercise, right? Any condition that they tell you, oh, this, you have to exercise. You have to exercise because of your heart. You have to exercise because of your blood sugar. You have to exercise because of your BP. The doctor is telling you need exercise. That's where physiotherapy comes in. It's automatically saying you need to see a physiotherapist, right? And then the third one is mobility. We are movement specialists. We are mobility specialists. So anything that affects the way you move, anything that affects the way your body moves, you know, your body is aligned in space or your body moves in space. Okay, let's say usually your shoulder, you can go all the way up like this, and all of a sudden you realize that you can't get beyond this range, right? Mobility has been affected, movement has been affected. Okay, the movement available at a particular segment has been impaired. That's where you would definitely need a physiotherapist. Okay, now a lot of people do not know, and that is why we are bringing this out to the open. right? So that you can also become advocates. You can also help in creating the awareness for people to know more about the beauty of the profession, physiotherapy. Now, today we are going to be focusing on back pain. And for us to understand this, I have to kind of help you understand the concept of back pain, of, what the back pain thing is about, right? And there are two things there, back and pain, right? So when we talk about pain, we are talking about unpleasant sensory or emotional experiences, okay, which are actually indicators of actual or potential tissue damage. It means that if you're experiencing pain, it means it's either there is damage already occurring or there's damage about to occur. Okay, so your pain is not necessarily a bad thing. Pain is just a way your body receives signal to, to defend itself or to get away from danger or to stop a dangerous activity. It's really a good thing, you know. However, there may be some negative aspects of it, especially when you do not understand the process, and then when the pain is beginning to affect your quality of life, affect your daily living, affect your activities, affect your job, your relationships. That's where it becomes a call for concern. Now, um, what is back? What is, lower back pain? What is low back pain? So I can use low back, I can use lower back, I can use lumbar or lumbosacral interchangeably. But forget the big grammar. In my place, the Igbos will call it upumbu. I don't know what they call it in Hausa. Maybe you will help me in the comments. Help me in the comments. Let me see. Low back pain, waist. This thing they call waist pain. What do they call it in your language? Put in a comment. Put in a comment section. Let me see. For us, I've already said Igbo version. I would have said if anybody gets it, I'll give them one plot of land in Lekki, um, or one Lexus GLK or Lexus V8. So what do they call it in your language? If you are Yoruba, tell me what they call waist pain in your language. If you're Hausa, tell me. If you're BBO, tell me. If you are Gala, tell me. I'd love to see that. Okay. So that is by definition, by location. Okay. Now the region from your last rib, the 12th rib, okay, if you go down to your, oh, somebody said Chiwombaya. I don't know if I spoke it correctly. Chiwombaya, Chiwombaya, Chiwombaya. So I try. I know say I try. Make una give me an award. So the region from the last rib down to the bum bum, underneath where the buttocks meets with the thigh, that crease. I wish I had my marker here. Oh, I'd have drawn a very good structure on my whiteboard for us to see. But that notwithstanding, beautiful. So I hope you can see this. Let me see if I can make something out of this. Okay. So now this is the right. This is the buttocks. And then this is the legs. If you no find that one concern you. uh, so this is the but this is what I'm talking about. Okay. Now, some people will say, some studies will go beyond this region, right? And get to this region. But where it begins is, let's say, the last rib is at this level. So anything from here down to here, right? So at this point, your back, and this is the spine. I know you are not hearing my voice very well. So let's say this is spine. This is where it meets with the buttocks. Now, this whole region from the 12th rib down to this crease where the buttocks meets with the thighs, that's where you call your low back, right? And remember, like I said, some people will go lower, some studies will go lower than that. So they are trying to tell us that any pain that you are experiencing within this region, that is what we refer to as lower back pain. Lower back pain. I sabi draw. Sabi draw. So somebody said Ibadi Riro. Ibadi Riro. I don't dey learn. Chiwon Baya and Ibadi Riro. If I didn't pronounce it correctly, when I pull up Kemi on stage, please help me and do justice. Kemi will pronounce Yoruba and then Hawa will pronounce Hausa. So that I'll learn that one very well. Okay. So good. That's what back pain is about. Okay. I hope you understand it now. I hope you understand it. Let me see if I can pull up a picture quickly so that you will see something here. Okay, the picture will come in later. It will come in later. So back to what I was saying. Back to what I was saying. Has any one of you experienced back pain before? Before I continue, has anyone here who is watching, have you experienced back pain before? Whether it was in school, secondary school, primary school, last year, last 2 years, last month, last week, last few minutes, today, tomorrow. You know, just tell me your experience. Share your experience in the comment section. Have you experienced back pain? There's this stigma that comes with lower back pain, usually, that if you are young and you tell people, it's more like you're not even permitted to tell people that you're experiencing lower back pain. If you're young and you're walking somehow and somebody asks you, what's going on? How are you doing? Why are you walking like that? And you're like, oh, my low back hurts. They're going to be like, no, 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 it's not proper. How can you, a young person, you've not even gone anywhere, you've not done anything. What is wrong with your back at this age? Right? But it's because people do not understand, and I won't really blame them. Okay, a lot of people do not have the right information, so they don't get. So if you have experienced it, don't worry, don't be shy. I'm not going to tell anybody. Just put it in the comment section. Okay, nobody will see it, I promise you. So I have had my own fair share of low back pain. Yeah, low back pain. I've had my own fair share. And it's always interesting, having experiencing such pains, even as a physiotherapist. It's interesting. Strange to say, but I must admit it's interesting, because you get to experience the same thing that your patients come to complain about. Okay, and you help them through. You get to also understand your own body. You get to understand the how well whatever it is that you're offering to people, how well those things work. So Vincent Favor says, yes, sir, I have. Vincent Favor. So any comment you see, you can tap on it. Kemi is here. Kemi, any comment you see, you can just tap on it, and then it will pull the comment up on stage. Any comment that all the fire emojis and responses, so I can just see them easily on the screen. um Currently experiencing it. Thank God. Thank you for being yeah, good. Thank you for letting me know. Currently experiencing it. So I've had experiences, you know and having to manage myself, having to also trust my colleagues to treat me while I'm at work. That's some one of those things. Now Vincent says there was no light, so I had to fetch from the well, and that was the onset of her back pain. And I'll tell you why this later on as we continue. I'll tell you why you know this is an issue. I'll tell you why that back pain came. I'll explain more. Now, what are the causes of back pain? Because some people, a lot of patients, when they come in, welcome Edward, welcome. When they come into the physio department and they meet me or meet any physio, they usually want to ask you, the doctor said this my back. The doctor gave me a report. The X-ray said the X-ray was showing that I have spondylosis. And usually when patients are giving such verdicts, they don't ask the doctor, okay, what is this? What is it? They just get anxious and afraid. Hey, this thing that is long like this, spondylosis. Imagine plenty things. They will not write so many things in the X-ray report that they don't understand. So whenever they come, they always ask us, we're on the receiving end of the questions. Why do I have this? Why is my back hurting? Why do I have pain? What is the cause of my pain? Okay, what is the cause of my pain? So it's now my responsibility to start explaining, what could be responsible for that pain. And remember, I said it is not one cause. It is usually not just one thing that causes back pain. Welcome, welcome, Adam. Welcome, my brother. Welcome. Good to see you here. So it's usually not just one thing that causes back pain. Okay. Now it is biopsychosocial. Biopsychosocial. We are now approaching, or let me say, embracing the biopsychosocial model of care. Okay. So it's not just biological, it's not just psychological or social causes. It's combined. Initially, we used to approach back pain. Generally, in the medical field, we approach back pain from a straight perspective of, well, there must be a tissue injury, there must be a mechanical damage, there must be something happening somewhere in the joint or in the muscle or in the ligament for you to say that someone has back pain. There must be a definite cause biomechanically. However, we're now beginning to discover, right, that it is a multiple cause thing. So different factors can contribute. Okay, different factors. And I have some of those factors written here. I have some of those things written here. Looking at this biopsychosocial perspective of back pain, number one is poor posture. Poor posture can be a contributor. It can be a contributing cause or a causal factor, right? It means that as a standalone factor, it can cause back pain. Yes, as a standalone factor, it can cause back pain. Then, as a contributing factor, it can also cause back pain. As a risk factor on the long run, it can also predispose you to back pain. So, poor posture, and this includes walking posture, sleeping posture, sitting posture, and all that. Now, the second one that I wrote here is weak core muscles. So these muscles that are here, your back, there are muscles around here, here, the muscles around all these regions, and even the front, right? The six pack muscles. Now, I'm not saying that if you don't have six packs that you'll be having back pain. That's not what I'm saying. But like weakness of the muscles surrounding your spine can result to back pain, to low back pain. Now, the next one is um, muscle strain, ligament strain. I mean, ligament sprain, muscle strain. So stress, undue stress or stretch in the muscles at these regions can result to back pain, can cause inflammation. It can cause, let's say, some little tears. When you if you overstretch this my hand now. There's a way you will stretch this rapidly. You will get an injury here. You will tear something, and before you know what's happening, the pain is just there. It's coming back. You're experiencing that pain, and it's giving you a lot of concern. So now, when you go do certain activities that involves overstressing your muscles, the muscles that are located in this region, you can cause such tears, and it can lead to back pain, low back pain. Sometimes we may not even know. And do you know that sometimes the posture that we assume also contributes to those tears? Okay? The posture that we use to do certain activities or how we sit to study and all that can contribute to those, straining of the muscles. Now, you see, mistake a lot of people make. You know what I was looking for now? My phone. Interesting. Now, the mistake a lot of people make is that I forgot that my phone was the one I was using to stream. So they want to use their devices, they want to use their phone, right? And this is what they do. Instead of actually ensuring that they are keeping to good posture, now they are going this way. I know a lot of people do this. That may even be what you are doing now. That may be what you are doing now. Now I'm watching you. I'm looking at you. That may be what you are doing now. I'll catch you. So they do something like this, and they are pressing their phone, or they take the phone way down and they are using it. Now, here, I'm putting a lot of strain, not just here, but the low back as well. Okay, not just the neck, because if you do that, if you do that, I'm going to explain some things about posture tonight. Just stay with me. I'm going to explain. So if you keep doing that, you notice because there's a connection between the muscles that run all the way down to the lower back. So if you keep doing this or this, this slouch position that a lot of people keep to work on their system, work on the laptop, do stuff in the office, or leaning forward. This is now okay. You may not be able to see my back, but like I was talking about something like this. Okay. So you see some people, they are working and this is the way their backs are, right? Now that's placing undue load. It is placing too much load on these muscles that are here. And now realize one thing. These are not muscles that you usually wake up and start training. In fact, even when you want to go to the gym, most times what people want is to build chest and build arms, right? So you want strong arms. I would have been flexing my muscles, but they are not even big. So, you want strong arms, you want big chest and all that. These are not usually muscles that people remember to train. So, when you are putting them under too much tension or stress, it is very much easier to injure them. Okay. I hope I'm not being too jargonish. I hope I'm not being too out of no, I'm not using plenty jargons. Are you getting me? Are you following? Are you following? If you are here and you are not a medical person but you are following, please comment. Let me know that you are following so I can continue. And if you are still in early career, I mean, students who were invited for this, the students who were invited from OAU and Ife University. Um, please comment. Let me know that you are following so I can continue. Is it making sense? Is it making sense? Or am I confusing you? Okay, thank you very much. Thank you very much. Okay, so I can continue now. Good, good. And one more thing that I want you to do, if you're joining, you can hit the like button. Wherever you're seeing this, you can just hit the like button, okay? You can just hit the like button and share. Share, invite your friends. It's about to get more interesting. Invite your friends, invite your family members, invite everybody you want to invite, you know, because this information I'm giving you can save you a lot. This information can be the difference between being in the theater. I mean, being rushed to the theater for an operation and actually leading your normal life, because there's always a narrow gap between you know life and mistakes. There's always a narrow gap. There are people who ended up in and this is not to make you afraid, it's just to give you information. There are people who ended up in the theater for a surgery that would have been avoided if they had known the right lifting techniques, or the right work position, ergonomics, how to position themselves to work. Okay, so people have, because they'll tell you their stories. I bent down to pick up my baby and I had a snap in my back. I had cramp in my back, and that was the beginning of my misery. So for 2 years, they are still attending, coming to the hospital, taking medications for their pain. So this information I'm giving you is going to be of very, very, very great help to you, and it will also help you to help other people by telling them what will benefit them with regard to back pain. Now, the next cause I need to mention is herniated disc. Okay, bulging disc issues or disc pathologies, disc injuries. Now I'll show you what the disc is. I'll show you. I'll pull up an image on the screen and I'll show you. Um. Okay, I'm going to bust your bubbles. Find that. I'm going to bust your bubbles. When it comes to posture, I'll get there. When I get to posture, I'll show you something very interesting. Okay, you'll be surprised. So let's go to the next. Let me show you something. I'm going to show you. Okay, I'm going to show you. Let me see. I'm going to show you an image for the spine. Where is it? So when I was talking about disc issues, I drew the spine. This is the spine I drew on my board, but um the one I drew, fine. So this is a clear representation of what I was talking about. Let's look at the spine. Okay, so if you can see here, um, the let me see. It's not something I cannot draw on it, but I wanted to. Okay, look down, because there are different categorizations, different sections in your spine. At the neck level, see this woman here on this picture. See that woman there at this neck region. Wait, ah, okay. So at this neck region, that's where we have the cervical spine. Cervical, okay. Here from the chest region, you can see her chest region. That's what we call it, the thoracic spine. Okay. Now below that thoracic, that's where you have the lumbar spine, right? Then after the lumbar, you now have the sacral. You know, if you don't understand what I'm saying, don't worry. Don't worry. It's not a must to know all these terminologies. The only thing is to know that these things are bones that protect the spinal cord. Okay. And the spinal cord, you see these yellow things coming out. They are coming out from the spinal cord. This yellow wire is looking like electric cable. These electric cables, they take supply. The brain is the main generator, that interprets sensation, receive the impulses. Receive impulse and interpret it, then send feedback, how the body is going to respond to those impulses. Now, these yellow things that you are seeing coming out from the spinal cord, they are the spinal nerves. They are the nerves. Okay, the nerve. Now these bundles of nerves now supply the different parts of your body, the hands, the legs, the toes, all that. Now, if you see this region, the lumbar down to where the low back is, that place is a bit reddish, right? That's our focus for today. Low back pain. Usually that's where it's either it begins from there or it extends to there. But that is the lumbar region, the lower back region. Now, this blue thing that you are seeing in between the bones, these bones are called vertebra. This blue thing that looks like gel, these blue lines that you are seeing in between those bones in the spine, that's what we call the discs, right? The disc. Okay, and that disc is made up of two different parts. One, the external ring that is kind of harder, right? Outer fibrous ring, and the inner one that is called the nucleus, that is not as hard as the outer one. Okay, now um this disc itself, something can happen to it. It can start damaging, and because of the damage, it can start protruding. If you see the image by the right, okay, you will see where the red end, so that's red. It's not as if it's red in color, but that end is now pushing on the nerves that are meant to be coming out from the spinal cord. And it is usually this reason that people will tell you, when this happened, I started feeling pain, and the pain was coming down to my legs. It was running all the way down. Some will tell you it was my leg was feeling numb, one side or both sides, it was feeling numb, and it was going down to the legs. I feel numbness, I feel sometimes weakness, or pain that is going down below the buttocks and to the knee and to the legs, that kind of thing. So this shooting pain that feels like shock, electric shock going down, is usually because there's an entrapment at this level, because the disc is pressing on the nerve, just the way you press agege bread. Just kidding. So other things can cause the compression at that level. Other things can compress the nerve at that region. Different other things. It could be degenerative changes. Okay, so the bone, the cartilage, the bone ends can start wearing out. Okay, these bones that you are seeing, this vertebra, can start breaking down. Okay, some other ends that are contacting themselves can start wearing out or breaking down. Could be as a result of trauma, I mean, impact trauma, crush injuries. It could be as a result of aging. As people age, some of those degenerative changes will start happening. It could be as a result of different things, processes that are occurring in the body, abnormally or normally, right? So those things can also cause pain. So why I'm saying this is so that we do not have in mind that there's just one cause, because sometimes all these things can be happening together. They can be doing collabo. Okay. Now, um, some people would see someone having back pain and they say, "Oh, it's your posture." Some people, when once you tell them you're having back pain, they will say, "Ah, it's because of your bed. What kind of bed are you sleeping on?" That's not the correct thing to do. And that's how most times people just make assumptions, and they start taking treatments from random people. Somebody will tell you, "Oh, go and change your mattress, go and buy new mattress, go and buy orthopedic mattress and be sleeping." Somebody will just carry money that he doesn't have. He has not gone to the hospital, he has not seen a physiotherapist. He will go and buy orthopedic mattress and start sleeping on top of orthopedic mattress just because his friend told him that no two people have back pain the same way. No two back pain cases are the same. In fact, for one person, you can be experiencing a different type distribution of back pain or type of back pain in January. And then by February or March, you are experiencing a totally different thing. And the physiotherapist's responsibility is to review and analyze again and again to see what is actually going on per time. Okay? So you can have an injury that is postural because of the posture that you are assuming at work. You can sustain a back injury, and you start having low back pain, but then later on you try lifting something and you have a disc injury. And then maybe while all that is happening, you are overworked, or something is going on in your workplace that you don't like. Your salary is not increasing, they've not paid you August salary, and all those things, anger, frustration, sadness, all those things are coming into the equation. So you cannot just point into one thing and say, "Okay, this is exactly what caused it." Okay. So yes, back to what I was saying. I've already talked about degenerative conditions and trauma, and which other thing do I need to talk about? One thing that we also need to understand is it's not all the time that back pain is, as a result of changes in the muscle tissue or bone or something like that. It's not all the time. Sometimes it could be referred pain, pain from internal organs. Okay, so pain from, let's say, the kidney can refer to the back. How do you know is this herniation from this topic is not for this audience, okay? It's not for this audience. However, let me just say something for the younger physiotherapists, younger physios students who are watching this. How do you know it's disc herniation? Now, there are different grades of disc pathology, different grades. Okay. Now, at the early stage, the earliest phase of the protrusion. Let me bring this back up. Now, this what you are seeing here is, yeah, this is a herniation, right? Because the disc, the inner content, the nucleus pulposus has penetrated the outer annular ring, that blue ring. I didn't plan to go start moving stuff here because I don't want to overwhelm my audience. Now, how will you know? There are differential tests that can be done. There are physical examinations that can be done to know if what we are suspecting is a disc pathology. Okay. Now the physiotherapist does the physical examination. Yes, yes, the session is being recorded. Now, the physiotherapist does the physical examination and is able to tell, okay, could this be a disc issue? If we are able to rule in that this is a disc issue, right, depending on what the patient is experiencing, depending on the severity of the symptoms that the patient is experiencing, we can now say, okay, this patient needs to do an MRI. Usually, MRI is the radiological investigation of choice. Now, go do an MRI. Let's find out the level of protrusion, okay, in but the only time this is necessary is if it's going to really change the course of your treatment, or if the patient is experiencing certain symptoms, worsening neurological signs, let's say weakness, pain that is not getting better, shooting symptoms that are going down the legs and are really, really disturbing the patient's quality of life, because usually it's not so recommended to just, because a patient is having, you notice that there's disc involvement, sent to MRI immediately. No, it's not usually advisable, because even with treatment, sometimes you can have patients experiencing such symptoms, and with treatment, first 2-3 sessions, they are already much better. We've had patients who would come after a few sessions and they are like, wow, okay, the pain is no longer going down my legs. It's just localized at my lower back. Okay. It's just localized. And I've been doing my exercises and now I'm getting better. They are more empowered. Yes, the diagnosis was disc whatever, disc protrusion, disc prolapse, disc slip, whatever. But then the main thing is that we are able to monitor, we are able to observe, we are able to watch, we are able to work with the patient, and the patient understands their own bodies. Okay. So I don't want to go too deep into that. Now, I was talking about organic pathologies, okay, organic issues. Kidney diseases can refer pain to the back, okay. Other inflammatory processes can refer pain to the back. This one is also another big thing I don't want to start talking about. Now, there's also the aspect of gynecological referred pains, pelvic inflammatory diseases and different pelvic floor issues that can refer pain to the back. Okay. Pregnancy as well can be a risk. Okay, I'm going to talk about risk factors. Back pain is also very prevalent among pregnant women, particularly for some of them by first trimester they're already having pain. For some, second and third, they're having pain. For some, it's like as the baby increases in size and they are not able to properly align their body weight in space, it results to a lot of changes in their body that can lead to pain. For some people, it is as a result of weakness in certain joints of their body during pregnancy because of a particular hormone that is released in, let me not say in larger quantities in the body, called relaxin. Okay. And that hormone can kind of make things a bit more lax than they used to. Okay. Now, yeah, risk factors, sedentary living. Sedentary living. If you live your life like a couch potato, there is higher risks associated with that. It is more likely that you're going to have back pain, low back pain. If you all you do is, if you observe me, you will notice that even while I'm teaching you, I am not I'm not sitting like a mango tree. I'm not just there like this, like a soldier, on singing national anthem. We were even meant to sing national. Well, kidney disease can cause low back pain. I'd love to know more about this. Okay, I'm not saying it. Okay, yeah, let's call it cause. Let's call it cause. Okay, so the kidney, the kidney issues, right? Kidney disease, kidney pathology can refer pain to the back, to the low back. And that's why management of low back pain is a holistic approach. It's multidimensional. Okay. So we are not just there as we are not the only specialists involved. When we see signs, there are usually other signs that are associated with kidney issues. And then when we do our assessments, and we find out from our assessments that this is most likely not a physical issue, not a musculoskeletal issue. I mean, it's not from muscle or joint or bone origin, and it's most likely a referred pain. There are ways to know, okay? And that is when we now send referrals. We either send back to the referring doctor or send to the specialist involved in that care and note our findings or our concerns pertaining to that patient. Okay, so that's it. You can read up. I don't know who is asking that question, but maybe you can just keep the questions for now. Yeah, you can look up later how kidney disease can cause low back pain, or how kidney issues, kidney pathologies cause referred pain in the low back. Okay, so I don't want to start going into the origin, how the human body was, I mean, was structured, and the origin of the embryologic origin and the relationship between the kidney and the low back, all those long stories. I'll spare you all of that. Okay, it's not needed in this particular setting. Now, the next thing I'm going to talk about is um obesity is also a risk factor. I was talking about, yeah, sedentary living. I told you it's not good to just remain in a place. Okay, to remain in your house watching television, lying down in one place as much as possible. Change your position frequently. Okay, I'll get to that later. Now, obesity, as you add so much weight, as you begin to add so much weight, it can affect, your bones, it can affect your body, it can affect your low back. Okay, you're now bearing so much weight there. Now, if you look here, you will realize that there's a dimple here and here. Okay, that we refer to as the sacral dimple. Here, there's a line here and here, right? Now, that line is what joins the spine to the low back to transfer weight to the legs. Okay, so it joins this spine to this, to help transfer weight. And what we have here is the sacroiliac joint. That's what we call the SIJ. Okay, now if you are adding more weight, because you are also going to be, I mean, gravity is not your friend. Gravity is pressing you down. And you're adding more weight. What's going to happen here is this is going to be suffering. Okay, too much weight, because you remember I said that we do not remember to train some of these muscles to bear the body weight. So we will not come and be adding extra weight on top. So you were weighing, let's say, 70 before, and all of a sudden you started weighing 86. Next thing, within the space of 2 months, you've gained that additional 4 kg or 5 kg, and not that 5 kg again. Before you know what's happening, people are telling you, what's happening? You are increasing, You're telling them, don't worry, evidence of good living. I love my body the way it is. My body, my own. My body, my type. It's my body. My body is my body. All those things that you used to encourage yourself. And next thing, boom, you have exploded. You are going to be, see, you can love yourself, but pain doesn't really love you like that. It doesn't, send you. Okay. So when you are increasing your body mass, when you are increasing your weight, you are going to be overloading this. Before you know what's happening, back pain has come, knee pain has come, ankle pain has come. So obesity or overweight generally can also be a risk factor for low back pain. Now, the next one is improper lifting. Improper lifting. Okay, if you do not know how to lift well, you don't know how to lift things from the ground, um you will be hurting your back a lot of times. Your low back, you'll be hurting it a lot of times. Okay, so that's it. Psychosocial issues, I mentioned it earlier: anxiety, depression, stress. I'll tell you a story. When I was in the national hospital, okay, ah, okay, I won't tell this story again. I won't tell you this story again. I will not tell you this story again. But just know that from our experience, you get to see patients who will tell you this pain is too much for me to bear. This pain is too, no, I won't tell you the story for confidentiality purposes. Okay, I won't tell you the story. But I'll just summarize it. I'll summarize it. Okay, I'll summarize it so I don't leave any necessary clues. Now, you meet patients. I have met a lot of patients who will tell me, I feel better on Fridays. You are just working with them. We're trying everything possible to make them feel better. but they're just like, I don't know. Anytime I come to work on Monday, Tuesday, Wednesday, I don't feel so good. The pain is just there, is overwhelming. But I notice that whenever it is Friday, ending of Friday, towards the end, when work's about, the pain just goes. The pain just goes, and a lot of times you may not be able to tell. This is where the biopsychosocial aspect, the multidimensional aspect of pain comes to play. You know, they are having the pain. Yes, it's mechanical to a huge extent. Yes, we know this is what we are seeing on an X-ray, on the MRI. This is what we are seeing. But there's another factor coming to play there. This person may not like the work that they are doing, may not be happy with the work they are doing, may not be feeling satisfied or fulfilled in that work that they are doing. The chair that they are using in their workplace may not be the best for them. Okay? So whenever they are coming to work, they are more anxious. And studies, research has shown us that if you're having back pain, most of the time, if the anxiety is increasing, depression and frustration is increasing, the back pain, will it increase or decrease? The back pain, will it decrease or increase? You can't bet what is coming to my mind now. You can't bet why I'm asking this question. Let me see your answers. Let me see your answers. The back pain, will it increase or decrease? Let me see your answers. I'm looking for something. When I see it, I will know. Okay. Demilade Adebanjo says increase. Olagunju Oladayo says increase. Vincent Favor says increase. Okay. Okay, okay. Nobody wants to make us laugh here. Okay. I was looking for something, but yeah, studies have shown us. Oluwaseun, no. Okay. That was not what I was expecting. This one took me by surprise. You swept me off my feet with this one. I've never heard this one in my life. In decrease. Okay, that's fine. That's fine. I watched that video. This guy who was asking his students, if the pressure increases, will the volume increase or decrease? And they're like, creases. So that was what I was looking to do here as well. But you all got it. Creases. Okay. So yeah, that's it. When the stress associated with your work, the frustration, depression, all those things, they are increasing. The back pain will be increasing. It will be increasing. Okay. So yeah, back to other things. Let's go to other things. Let's move on with our lives. Let's move on. Yeah, I've seen it. I've seen crises. Okay. So having said all these things, there are many other causes of back pain. So many other causes. Okay, and that is our primary responsibility, is to help uncover what could be causing the pain, and then we don't just stop at uncovering what it is. We start managing, we start treating, we start teaching you how to manage your own pain too. Now, okay, let me see. Okay, I'm trying to get the full screen. I'll still bring you back. Now, like I was saying, um we've been here for 1 hour. Let's say, let me see. Okay, come back to the stage. Kemi, come back to the stage. So let's do something. Let's do something. Okay? Let's do something. You can take a one, no, not 1 minute. If I say 1 minute, some of you will run away. You can start watching Telemundo. Okay, so you can just pause here and let me bring you up on stage, Kemi. So you can pause here, just get up, stretch, turn to your neighbor, smile, bill your neighbor, collect money from them. Uh, tell your neighbor to give you, even if it's small $10. Tell your neighbor to give you now. Yeah. Any neighbor that you catch now, anybody that's around you, walk up to them and say, "Give me $10." That should be like maybe 16K or so. Mm. So we're going to do a small break. This is, just for you to relax, for you to stretch, for you to breathe, drink water, but hold your phone, so that you don't run away. Hold your phone, go and drink water, just walk around small. And then you will come back and we'll continue. So at this point, ah, I don't know you. I don't know you. My hand is not in this one. I don't know you. I cannot see anybody here. I cannot see anybody. If I saw someone, I just giving them, but like I didn't see anybody. So okay. So I just want us to take a break, stretch. Let me even teach you how to stretch. Because some people used to think, when I tell people about stretching or about taking breaks to do some things at home while they are watching TV or attending classes like this, they think it's rocket science. They think it's a big deal. Okay. But sometimes it's not like that. Even if you are traveling, there are some stretches that you can do in your car, in your vehicle, as long as you're not the one driving. Don't go and be driving and doing stretches inside the driver's seat. I don't say that one. No, I'll deny you. I'll deny you. So, you can just we are always usually in a fixed position. So you can unfix yourself. Just go, turn your neck to one side, go to the other side. Okay? Look up and down. Not like you're trying to look down, sha. But just as if you're nodding, okay? This, go to this side, go to this side. Take your eyes off the screen. Focus on something else that is far away. Maybe your window. Just focus on it. Look at it. Look for something written on the wall. Focus on it and read it. Let your eyes realign with the environment, right? You know, you can stretch. Put your hand this way, go all the way back, look up like this, and then come back. You can be doing this and you're taking deep breaths. Okay, you're doing some deep breathing exercises. Okay, now something like this. I do this a lot for myself. Okay, so yes, I hope we are following. I hope we are following. As I'm doing it, be doing it. Okay, that's part of the break that we are taking here. Hmm? So, do that. Get up, walk around. Get up, walk around. As you're holding your phone, don't drop it. Don't shift. Don't start watching football. As you're holding your phone, just get up and walk around. Okay, get up, move around a little bit. Drink water, come back, sit down, stand up. As you're even watching this, you can be moving around your house. As long as you have not been trekking too much, at least you still have energy to walk around small. This economy, sha. Let me not talk. Ha! I came back the other day, my legs were just hurting. My calf muscles were just on fire. The pain just resolved today. I I did trekking unlimited, because everywhere you touch, they tell you, you enter motor from here to here, 1,005. Enter from here to here, 2,000. Before you know what's happening, one day 6,000 has disappeared from your pocket. Bike people, something that used to be 100 naira is now 250 or 300. At the point I said, no, I cannot continue like this. Under one day, I said, let me just trek. I came back from the junction. I trekked to my house. Hey God. I woke up early the next day. I woke up early. My legs were shaking. I had not done that in a long time. So, but as long as that's not your own case now, just get up and move around small, walk around, break the sitting cycle. Okay? Break the sitting cycle. Now, this is part of where we come in as experts when it comes to back pain prevention management. So what I do, even when I go for events, conferences, workshop, I go for those events a lot. Conferences, workshops, programs, this and that, even in church. There's a way I'll sit for too long. I mean, once I start feeling any form of discomfort, the slightest discomfort to your back is a message your back is sending to you. Hey, I need help. Let the back breathe. Let the low back breathe. That's what it is saying. So any slight discomfort, I'll get up and go and move around. Go to the restroom, move around. Stretch. Just do some stretches. Hold your hand on your waist, look up, go back like this, and come back. Now, usually, you notice that most of our activities during the day, are usually in a slouch position. We're usually doing activities in a slouch position. So one of the things that you will do to help yourself is reverse that. Open up, open up the spine. Keep doing some of those basic movements to help with mobility. Now, break time has finished. Back to what we were talking about. What is my role? What is our role as physiotherapists? As experts in pain management, in mobility, movement dysfunctions, exercise, what is our role? Number one, education and awareness. Education and awareness. So we teach people how to prevent. And even when, okay, this one now is in prevention. Prevention. We teach people how to prevent low back pain. Some of these things I'm telling you now, golden nuggets. It's going to help you prevent low back. When you understand these things, you will be able to lead better lives, pain-free lives. Okay, now prevention of low back pain, posture, ergonomics, body mechanics. So we create awareness, we educate. Body mechanics, how to align yourself, how to move well, how to ensure that you are lifting things well. Those ergonomics is simply about how you as a human being interact with your workspace, interact with everything around you, your environment. Okay, that's ergonomics. Not economics, so not economics. Ergonomics, ERGONOMICS. If you heard me correctly, you can put it down, or if you know the spelling, you can put it down in the comment section so that others will see that. Now, we educate people. We tell people how their workspaces should appear, how they should arrange things, how they should put their computer, all those things, so that they don't end up, experiencing pain in future. I believe so much in preventive healthcare, preventive medicine. Beautiful. So instead of waiting for this thing to happen, so that we now go and start taking medication or start booking surgery or start doing this or that, let us prevent it. A lot of tech people, a lot of working class people, a lot of civil servants are putting themselves in preventable dangers right now because they lack the adequate knowledge. Thank you very much. Thank you very much. All those who are engaging, thank you. They are putting themselves in dangers. They are putting themselves at risk of low back pain and so many pathologies just by sitting too much. Okay? A lot of people don't have the right information. So we educate, we empower, we teach. Okay? So good. Now, let me show you something. Let's run through this quickly. Okay? Now, let's go to this image. Let me pull it up. If you can pull the image of the posture. Okay, no, I don't think it's in your own one of the images I sent to you. But let's see. I'll talk about sitting posture. Yeah, pull up the sitting posture image. Good, beautiful. Thank you. Thank you. Now look at this. Sitting is the new word smoking. Working for extended periods of time in the wrong posture, like many of us do at work, takes a toll on our bodies, just like smoking. It increases the risk of various health problems, including what? Back pain, neck pain, shoulder pain, reduced circulation, fatigue, workplace-related MSK, musculoskeletal disorders like tendinitis, carpal tunnel syndrome, thoracic outlet syndrome. Leave all these ones. My matter today, now back pain. Now why I come here. Okay. So now look at these two guys. Who is you here? Who is you? Which one is you? Is it the first one or the second guy who is sitting like that, probably working on his computer in the office that they did not even arrange well, or playing video game, or pressing phone, or watching Telemundo, whichever one. Okay? Then the other person, can you see what the other person, the way the other person is seated comfortably with a backrest? Now, notice that chair is not exactly meant to be 90 degrees. Okay, this is not, if this were a regular, a typical ergonomics class, I would have gone into more details, right? But the chair does not necessarily have to be 90 degrees. Okay, and there are some truths that we have to understand about posture and myths that we have to debunk. Proper posture does not mean 90 degrees. No. Proper posture does not mean sitting like a mango tree that is dead, that cannot move. No. Your best posture is your next posture. This is part of what we help people understand from the new dimensions of ergonomics and healthcare. What we now know about proper posture is the best posture is a mobile posture. The only time you are permitted to remain still for long is when you are sleeping. And in fact, your subconscious mind takes care of the movement. So you don't even know that you are moving when you sleep. Okay. So your chair should be well organized. There should be something to take in that lumbar curve, that curve in the lower back. Some patients will go for x-ray and then, they're having pain. They send them for x-ray. The doctor can't see anything that is causing the pain from, the physical aspect of it. And the x-ray too is not really saying much apart from the fact that the back is straightened. So the lumbar curve is disappearing because the person is consistently putting their back in jeopardy by looking like this second person. This one Akara X, this one that they use red mark to write X on. That's what many people are doing to themselves. And at the end of the day, you now see the person's back, the way they are walking it has affected so many things, right? So don't be like that guy. Don't be like that guy. Move. Okay, as you are sitting, tilt, do some, shake body small, get up, move around, bend forward, bend backward, swivel your hips, and that's how to do it. Now look at the other lead, the two people downstairs. Those two people downstairs. I don't know what the other person is doing, but the lady, that's what a lot of us do. Bend forward like banana and pressing phone. Now let me show you. You can remove it off the screen. You can take it off the screen now. Let me show us this, right? If I want to use my phone, okay, I'm going to pull myself on full screen. So thank you, Kemi. So now, if I want to use my device, right? This this power bank. Oh, this, let's pretend that is my phone. Let's assume. You know the way your lecturers in those days, they want to they, will- they want to teach you something and they're like, let's assume this is real life, or let's assume that this is the leg, or this is the muscle. Let's assume that this is my phone, not my power bank. Okay, let's assume. Now I want to use my phone, right? Now, instead of doing this, let me bring this down. Now, instead of doing this, I'm already feeling pain in my neck. I wonder how people do this these days. You people are strong. If you are doing like this, you are very strong. Oh. Iron Man. Eh? People just be like this, and they are pressing their phone, right? Like this. Too much strain here. How should you do it? Now, this is what I teach people. If you understand this, you are going to be free from a lot of unnecessary pain. Now, what do you do? This is the phone, right? This is your other hand. Cross the other hand like this, like patience also, and bring the phone this way. You can use the phone, right? So if what you are doing requires the two fingers, you need to type with the two. Well, yeah, you can do that and then bring it back. After all, is it not TikTok that you are watching? Is it not TikTok? Is it not TikTok? Is TikTok now? It's TikTok and Facebook, and you are not even creating content. You are watching other people's own, so you are just scrolling. One hand is enough to scroll. So use this hand, put it, protect this one. I mean, guard this one. It acts as an anchor or a leverage mechanism. Then you can use the phone. This way, I don't have to bend my neck so much. So I'm literally able to control whatever I'm doing just with my eyes. I can look down, look up all the way. I can see everything I want to see. There's nothing I'm peeping under. Okay, so you literally make your life easy. by understanding the right approach to posture and all that. It's not rocket science. Okay. Anything that you are doing and you start feeling strain, the problem is sometimes we don't listen to our bodies. We treat our bodies like a submissive partner that cannot talk, that doesn't have any right in the relationship, that shouldn't, if you dare talk anything, I say, in fact, I cannot even hear you. So sometimes it's talking, but you can't hear. Some people are like that, you know. Don't go and marry somebody that's like that. Hey, they talk my own. Oh. So, you know, that's how we treat our bodies. So your back is hurting you. Is there shouting? But what is more important to you is that what is going Kim Jong Un and Kim Nana? What is going to happen between Kim Jong Un and I don't know the names I'm calling. I think I've heard those names in K drama. People are always Kim Jong. I don't know, Sha. But that handsome Korean guy, what's his name? Kim Gujumpio. So I don't know again, but Sha, one of them. You want to know what's going to happen, so you are just focused. Your back is hurting, but you are just there, right? So that's not proper. Whenever listen, be careful, be attentive to your bodies. Whenever it begins to give you sign, oh, we need to move. It's a sign. That discomfort is a sign. Okay, you need to move. You need to get around, move around, walk around, and all that. Okay, so that's part of what we teach people. One's over for you. Lee Min Ho that will not let us breathe. Hmm? Every Nigerian lady you touch. Lee Min Ho. I beg. So leave Lee Min Ho. Leave Lee Min Ho. Let me catch him in Abuja. Let him just cross Nigeria. Okay, on a lighter note, I got that one. I got Gujumpio. I got that one. I think I didn't know this. She's the same person. It's the same person now. It's Lee Min Ho that acted Gujumpio. Hey, let me not embarrass myself. I don't even know. Let me not embarrass myself on live TV. So now, education is important, right? We educate. We educate people about posture, ergonomics. You've seen some of these things now. Now look at this image. Look at this image. Um, whatever on top of there. That one is not what I'm looking at. This is how your workspace should be organized. And this is part of what we help people understand. Okay. Now, you see the screen, the top of the screen is at eye level, not too high, not too low. Okay. The person is going to be able to walk within that angle. Look at the chair that the person is sitting on. It's a bit inclined. There's a curve there that takes in the curvature of the back, that lumbar curve. There's a provision to take in that curve to support the back very well. Okay. And then I love this chair. Something that I'm even seeing now for some of us who have coccyx pain. It's called coccydynia. Some people have tailbone pain. They don't even know what it's called. They don't know what they can do about it. But some people have pain in the tailbone. It's not something a lot of people are proud to talk about. But I'm an ambassador. I know how it feels. I've experienced it. You know, this is also very good because it relieves the pressure off the tailbone because of that gap between the back of the chair and the floor. I mean, the one that is carrying you, the main. Then the padding at the elbows also good. You see how it aligns with the table. So if you are using a mouse, you don't have to be hanging your hand or putting it. So all these things are, there are a lot to say about ergonomics. And again, it's not like it's the main topic of today. I'm just trying to give you small passerby information that would also help you. Okay. Remember, the main thing is not the perfect posture. There is no perfect sitting posture. Your best posture is your next posture. Okay. So stay mobile, stay flexy. Now, the next thing that we can teach people about to help them prevent back pain, low back pain, is physical activity, the role of physical activity and exercise. There are exercises that you can be doing. You can remove this from screen. The exercises that you can be doing that can help you prevent lower back pain. Okay, activities, just even as simple as mobility, moving, staying mobile, staying active, staying physically active. You know, it's part of what helps to relieve back pain, or to prevent back pain. If see, once you identify all the risk factors and you're able to do something to mitigate those risk factors, it will be you have lower chances of having low back pain. Since we've said sedentary living is a predisposing factor, is a risk factor, if you break the sedentary living cycle, you would have lesser chances of experiencing back pain. Okay, so all those things, um, improper lifting technique. Now let's look at that improper lifting. I didn't talk about. Okay, let me talk about it when I get to ergonomics. Okay, physical activity and exercise, um, core strengthening, mobility training, flexibility. Let's leave that one. Let me go to, please. Okay, I'm not sure I sent you that one, but this is what I wanted us to see. Okay, yeah, thank you very much. Thank you. So I don't know if I can enlarge this image. I cannot enlarge it, but sha, let's just look at it the way it is. Okay. At the top level, it's showing you how you should lift, right? The lower one is showing you how you should not lift. So look at this guy. Just look at what this guy is doing. He thinks he's power mic. See the first guy under. He thinks he's power mic. You want to go and lift everything. Lifter of men. You want to lift anything you see, you want to lift. You want to do everything alone. Please learn to ask for help so that you don't strain your back and damage your spine. Okay? Especially for heavy items. There's no point. You're not trying to prove to anybody that you are superhuman. Now, the next one is, twisting while lifting. The next one is lifting with your back. And the next one is lifting heavy loads. Instead of just using machines or any leverage system to make it easier for you. Now let's concentrate on the third person. Let's look at that third line, that third row, third column. Ehen. It is very important to lift with your legs instead of lifting with your back. Okay, see how much tension is on this guy's back here, right? So it's important when you want to lift things from the floor, especially heavy items, lift with your leg. That one on top is more adequate. Okay? Lift with your thighs. Let the contraction force come from your thigh instead of your back. If you try to lift anything, listen to me, if you try to lift anything and then you start feeling stretch in your lower back, you start feeling discomfort in your lower back, you are lifting incorrectly. Please discontinue, pause. Either you are asking for help or you are changing the technique that you are using to lift. This singular information can save you from the theater. This singular information can save you from many years of misery and anguish. Please learn to lift with your legs and not the back. Okay? If you follow me on social media, I'm going to be doing more. I'll putting up more content on these things. I will be. I've had it in mind for a long time, but I think it's the right time now to keep doing that. Sharing this information so that more people will know about the right lifting techniques and all that. So, um, good. Now, ergonomic assessment is also part of what we do when it comes to prevention. So we can come to your office and say, okay, where your office is, the computer is not arranged well. Look at how your mouse is. See your jakala keypad at the keyboard. See the way the thing is. It's going to be disturbing you. Adjust your chair height. Adjust this. These are the things that you need to do. This is your computer. So if you're working with two screens, see how you will arrange it. If you are really, especially all these tech people. So that's part of where we will come in to say this and this and this, do this. If not, you will be a victim. You will most likely become a victim in the future. So prevention, that's part of what we do. Okay, ergonomic assessments, assessing workspaces. Even in hospitals, you can go to the surgeons, whatever, and see where they are doing their operation, how the operation table, the height of the table is affecting the medical doctor, and how you can, the surgeon, and how you can adjust and all those things. That's part of where we come in. Okay, you can even, if you are building a house, if you are building maybe your real estate, what will I call it? You are building a big house. Okay, you can come and call me. come and call me. They say, oh, yeah, come and assess the the workspace. Come and assess the way this thing is. We have an elderly person in the house. Putting it into consideration. What do you think we need to do here and here? What kind of floor should we use? All those things. That's part of where we come in as physiotherapists. Okay. So the truth of the matter is, as a physiotherapist, if you know what you are doing, you can never be stranded in this life because there's unlimited. Is it prevention? Is it treatment? Is it education? There's unlimited opportunity for you to thrive. Unlimited. It's actually very beautiful knowing that there's so many things, there's so many roles you can play. There's so many your patients will come and they are literally seeing you as a demigod. If you There's some patients that if you tell them, don't ever eat fufu again, they will stop eating fufu one time. Me, I'm not saying fufu is bad though. That's my favorite. It's my favorite food. Fufu and egusi soup. So I'm not saying it's bad. I'm just giving you example. So there are some patients you will tell, oh, don't do this. They will adhere one time. So you have so much authority by the virtue of being a physio, or I mean being able to help your patients get rid of their pain. The fact that they are getting better, anything you say, they will take it. Okay. So there's unlimited opportunity for you. There's so much fulfillment that also comes with helping people get better. Generally. Now let's go to the next thing. Our role in management. Our role in management. We assess. We help to make diagnosis. We make diagnosis independently. So the doctor doesn't just send and say, "Oh, this person has this straightening of the lumbar spine, this one scoliosis, and send, or say spondylosis and send." No, we see that, we appreciate it, but it doesn't mean we'll just start treating like that. No doctor has the right to tell the physiotherapist to do certain this, give this or give that. No, physiotherapy is an autonomous profession. So they are sending and saying, this is what we found out. But do your own examination, do your own test, do your own have your own findings, and manage the patient as yours, right? And we start treating. We still work hand in hand, but there's that mutual respect that this is my own field. Okay, this is my own field. So this is what I'm going to do: assess the patient, make diagnosis, plan treatment, and execute. Okay, now you help the patient's recovery journey. Now the next thing is the treatment, different things we can use to treat patients. There's manual therapy. Okay, manual therapy, massage, the almighty massage that many people love. Massage is one of the ways we can help treat patients, help alleviate their pain, help to relax muscles or awaken muscles, depending on what we want to achieve. There's manipulative therapy. So you may have been seeing some of these videos on Instagram where somebody will grab somebody's neck and do quack, grab another person, quack, draw this thing, turn, all those things. Yeah, that's you know um what we call manipulative therapy. And we use that as okay. So we use that as a means of treatment. Okay. So now there are so many barriers. Okay, so many barriers to assessing physiotherapy. So what I have here, I'm going to I think in the next 5 minutes I'm going to be done. In the next 5 minutes I'm going to be done. So if you have any question, you can throw the question in the group chat. If you have any question, throw the question in the group, and then you've tried. You've all tried. This is 1 hour 30 minutes. Wow, that's a lot. So, like I was saying, I'm going to just go through what I have here. I won't be dwelling on them so much. With time, I'll do more sessions. I'll explain more. Right? I'll adjust the casting for them. Now, barriers to physical therapy access. What are the barriers to accessing physiotherapy? Number one is delayed referrals. Sometimes the doctors don't refer early, and it's not their fault. Sometimes they don't even know that they should refer. Okay, and their training doesn't really extend so much to referral policies and when to refer and all that. So I won't really blame a lot of them, right? Now, I've met patients that they're having back pain and they'll tell you, oh, I've been to the hospital many times. What happened? They gave me medication. They gave me pain medication, painkiller. I took the painkiller. It just reduced the pain for a while. It just masked the pain for a while. And after, a day, pain came back. So I keep taking painkiller, painkiller. You keep taking and taking and taking until you start having issues, right? Now, the other one is false conceptions and myths about physiotherapy. Some people will tell you, oh, physiotherapy again. No, me, I don't want to do physio. I don't want to feel pain. It's painful. This one. People think physiotherapy is painful. They have in their mind no pain, no gain. But that's not actually true. It's not every patient that comes to physiotherapy that will be fat. Hardly will you even see patients that come to physio and they are shouting. On very, very few occasions. Okay. Some people come, once you touch them, they sleep off. Once you put one thing or the other on their body, they've gone from there. They sleep. And then as they are going, they are smiling and squeezing money into your hands. And so that's also a part of physiotherapy. Now, um, physiotherapy is beyond massage. That one is a topic for another day. Massage is one of the things we use for treatment. But when you hear physiotherapy, the first thing that should come to your mind should be movement, mobility specialist, exercise specialist, pain management experts, not massage. Okay, so if you are still having massage in your mind, on massage yourself and remove the massage small, keep it somewhere, brush it away. That's part of what we use for treatment. Now, shortage of physios is also a challenge that keeps many people from accessing physios. Physios are running away from the country now in their numbers, so we don't really have enough staff in most places, right? So it's usually a bit difficult for people to even find physios. It's a bit difficult. But what you should do, I'm going to talk about that later. Now, the consequences of this lack of access to physiotherapy. What are the consequences? Number one is over medicalization. People are taking a lot of medications just because of, just because they are not being referred early to physiotherapy. People are taking a lot of medications, small thing, Panadol, small thing, ibuprofen, small thing, cocodamol. Next thing they're having ulcer. Next thing they're having heart issues, heart disease, liver issues, kidney problems. You know, a lot of people are having so many issues that were caused by opioids. So that's where opioid crisis comes in. A lot of people even get addicted because of pain medications, consistently taking pain medications. Some are taking antidepressants, some are taking all sorts of things. Some are taking abo. Take abo to the point the abo will abolize your kidney and your liver, simply because the person is not aware that there's actually a provision to receive help, and that is physiotherapy. Okay, now, yeah, yeah, good, good. So now, the next one is issues with prophylactic surgeries. Now, because patients do not get referred to physiotherapy early, or because some people do not want to refer early, as the case may be, sometimes they get too early referrals to surgery. So a patient comes and they look at your back and say, oh, this back, this is how the x-ray is, this is what the x-ray is saying, this is what the MRI is saying, you need to be in the theater. They call it prophylactic surgery. Person now enter the theater, they cut open, do what they want to do, and then by the time they are done, patient has lost sensation in their lower limbs. Next thing, they can't walk again. They say, oh, there was an injury that was acquired during the surgery and all that stuff. So, yeah, usually this is because of poor access or derived access to physiotherapy. Okay. Now, the next one is, poor quality of life. Lack of access to physio or lack of referral to physio can affect the patient's quality of life, or the clients, whoever it is, can affect their quality of life. And then reduced productivity can lead to mental health issues like depression, anxiety, irritability. All these things are happening to one person. And then finally, when should you see a physiotherapist? When should you see a physiotherapist? When this pain has gone, if you're experiencing lower back pain and the pain has been more than a week, okay, and it's not remitting, it's not getting better, yeah, it's disturbing your work, it's disturbing you, you know, even if it's been less than 1 week, as long as you have access to a physiotherapist, nothing stops you from seeing a physio. Now, if you have pain after a traumatic event, so let's say you fell down on the staircase and started having low back pain, you you try to lift something and you heard a sound, and you had that snap in your low back and you started having pain, that's what we refer to as a traumatic event. Or somebody hit you on your back, you started feeling pain, you may need to see a physiotherapist. Now, if the pain is radiating, pain is coming down to the legs, or going down to the buttocks or something, um, that's also a sign that you will need to see a physiotherapist. What are the exercises? Now, today's session did not go cover the exercises. Okay, this is an introductory session. The best person who can give you exercises to do would have to assess you objectively, and that is your physiotherapist. It is dangerous to go online and see videos of people doing exercises and copy the exercise and want to do it because of your pain and feel like it's going to help you. Sometimes it works, but sometimes it can be dangerous. Okay. So now, another thing that you should see that will require exercise um, is okay. Now, don't worry, I promise I'll do another session. I'll do another session. We'll do basic exercises. We'll do basic exercises for, let's say, prevention of low back pain and all that. I'll go through that. I'll probably just arrange something and demonstrate them by myself. But tonight, no, I won't be covering exercises tonight. Okay, I've already done a few stretches now. Next stretch is moving around and all that, but there's more. Okay, I'll come back and demonstrate. I'm giving you that promise. Now, the next one is when this pain has been long standing, chronic pain that you did not receive, you didn't get a referral to physiotherapy for. So you see patients that will come and they're like, this pain has been there for 20 years. Oh. And you're like, have you ever seen a physiotherapist? And they're like, no. Why haven't you seen a physiotherapist? And then nobody told me. So even if nobody has told you, now that you know, go and see a physiotherapist. Request by yourself. In some parts of the country and most parts of the world, especially in advanced countries, physiotherapist first contact. You can carry your pain and waka into physiotherapy department and say, oh, I'm having this and that, and you'll be attended to. But in many parts of this country, due to certain issues, particularly legal and structural bureaucratic purposes, especially in hospitals, where there's a multidisciplinary structure, you would have to go to the GOPD first, the general outpatient department, meet a general doctor, and they will now refer you to physiotherapy if after the assessment. Sometimes they won't, they'll give you medication. But you knowing now, that's the purpose of this, you knowing these things, you have to be able to tell your doctor, sir, I want to see a physiotherapist. So make the request personally. I want to see a physiotherapist. Someone told me I want to see a physiotherapist. I demand to see a physiotherapist. Let it now be that they did not refer you, but demand, and they will definitely have to. Okay. So now, um, I'm going to say at this point, um, no grief for anybody. No grief for anybody. Okay. Fall in love with physiotherapy. Look for physiotherapists. Gum body with physiotherapists that you can always approach and tell them about your pain, and then they'll tell you the right thing to do. Now, for the students who are here, thank you. For all of you who are here, I'm going to be giving you a special reward if you have stayed till this point. If you have stayed to this point, just comment in the comment section. Let me know that you are still following. Let me know that you are still here. I don't know how you are going to do it, but it's only those that stay to this point that will even know what I said. So reach out to her. I'll send her something. I'll send her something to send to all of you who are still here. Reach out to her, and I would want to have more conversations with all of you. Now, for the students who are here watching me at the sound of my voice, um, physiotherapy is a beautiful profession. I'm yet to see anything more rewarding, honestly. My own personal opinion. My personal opinion. I'm not trying to lure anybody, but it is absolutely beautiful. It is fulfilling. Patients call me, Chijioke, thank you so much. Thank you so much. That pain, I've not felt it again. Thank you so you gave me my life back. Thank you. I can literally, I'm very happy. You know, what about pain that comes from I was, I'm going to come to this, So that response, that feedback that you get from patients that you have seen, you have attended to, it is so blissful, so amazing. Okay. So physiotherapy is a beautiful profession. If you give me anything now, I'm not interested. Any other thing, I'm not interested. I love practicing as a physiotherapist. Back to the question, what about pain that comes from standing for too long? Standing for too long can cause pain. Yeah, can predispose you to pain. However, um, if you're having pain standing for too long, break the standing cycle. Stand after a while, sit, stand, sit, alternate. And but if it is something that is overwhelming you, because when you are standing, if you stand for a while and then you start feeling pain in the lower back, sometimes it could be as a result of an underlying issue with the back, maybe with the spine or the disc that can, cause that. But for a lot of people who don't even have any injury, right? For the back pain, whatever, if you stand for long, you still experience back pain. Okay, so it depends on what you mean by long. Is it like 1 hour, 2 hours, or 30 minutes, or 5 minutes? You stand for 5 minutes and you're already having pain, then you have to go see your physio. That one is too early. I mean, 5 minutes is too short to just start experiencing pain like that. You can imagine being a teacher and stand for 3 minutes and you're already having back pain. No, it's not usual. Okay, so you should go see your doctor and request to see a physiotherapist. If you are having anything, I'm done. I'm done with this session. I'm just responding to the questions. Then I'm reading the comments. Okay, so you can start pouring in your feedback. You can start talking about your experience learning from me tonight. It's been an amazing time, with you as well. So what I was saying is, if you go to the hospital and then you tell your doctor, "Oh, I'm experiencing pain. This is what is happening to me and all that," and they give you medication, or anybody dismisses your pain by any means, okay, let them know that you want to see a physio, okay? Let them know that you want to see a physio. Let nobody tell you let nobody tell you, yes, ulcer can refer pain to the low back. That's part of the referred pains that I was talking about. Yeah, ulcer can refer pain to the low back. So let nobody tell you. And one thing I want to also let you know and understand is, thank God, um, these things can occur simultaneously. It means that ulcer could be referring pain to the low back, and then there's also some musculoskeletal issue. I mean, there's also some structural issue in terms of maybe posture, okay, or muscle tightness or spasm that is contributing to, I'm now speaking plenty grammar, but there could be other things happening to the muscles or the bone that could be contributing to the pain. Okay, so you will still need to be assessed. It is from assessment that we can tell, is this is this singularly ulcer pain that is referred, or is it a combination of the ulcer pain, that also the referred pain from the ulcer, and another issue altogether? Okay, so that's where you need to look into, and that's why you need to see a specialist. You need to see a doctor who would probably refer you to a physio, or you need to see a physiotherapist, whichever way. So that's my answer to your question. So you need to be able to you need to be able to insist. You need to be able to go and tell. I know why I'm saying this. I know why I'm saying this. I've met people. At some point, I felt like crying. I felt like weeping. Somebody will tell you, I've been I've been complaining about this. Whenever I come, they give me medication. I've been complaining about this pain for 3 years. 3 good years. Whenever I come, it's medication. I take cocodamol. I take this one. I take ibuprofen. I take this one. I take pregabalin. I take. And at the end of the day, you're now like, they will tell you, I was not even having ulcer. Oh. It was when I started taking all this medication that I started having ulcer. And now they are telling me that I have heart condition. I don't know where that one came from. I have heart issue. They say it's enlarged heart. That this one, that one, that one. Then you now realize it is opioid crisis that we are talking about. Medication, 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 simply because they were not aware of physiotherapy. Meanwhile, there are some people that will come for physio, and within the first 3 sessions, 4 sessions, 5 sessions, they discharge themselves. Yes, there are still a lot of people that will come and will see them for weeks or even months, but their lives will be significantly better And gradually we get to wean them away from the drugs, those medications that they are always taking. So that's the purpose of physiotherapy. We tilt largely towards non-pharmacological, non-invasive management of pain. So there are many things we can use to treat pain: cold, hot, electricity, touch, which other things, sound waves, so many things that we can use to treat pain. So that's it. I'll prefer to stop at this point so that I can even myself I can go and drink water. Okay, so yes, well done, well done, well done. I'd love to hear more from you all, and I'd love to see the effect of this. Talk about the lecture. Tell your classmates. Tell your parents. Share the knowledge you've gotten here tonight. Talk about it on social media. If you talk about it, tag me. I'll be glad to read. I'll be glad to see it. Share this video everywhere you can. Share it on Facebook. Share it on LinkedIn. Share it on which other place on YouTube. Yeah, you can copy the link on YouTube and share. Just anything you want to do. Okay. But when you share, let me know that you've shared. Okay. Once you share it, let me know that you did that. Tell people about it, talk about what you learned, and I believe you've learned a lot from here. So thank you very much. Kemi, please take it over from here. Thank you very much.
Thank you very much for the wonderful session, Coach CJ. That was very, very, very educative. I couldn't stop jotting down things. It was educative, it was informative, it was a whole lot. So if you're still here with us, kindly send in the highlights, what you learned, what you think stood out for you during today's session. Kindly drop it in. And if you still have your questions, you can send it in. I'm giving us 1 minute to send in our questions. If you still want, if you still have questions. Okay, somebody is saying, how about the posture you talked about, sir? I think he already said he's going to make another video on postures. You already said that during the course of the talk of the session. So you can follow his page, follow the LinkedIn page, the Facebook, the YouTube. The links to these pages you can find it the caption you used to join this session. You can find the links there. Thank you very much for joining tonight. Coach CJ, we really, really appreciate you. This session was wonderful. It was very, very, very wonderful. Thank you very much, IFUTSA, for this opportunity to learn. Thank you very much, IFUTSA. Yeah, Olagunjo Oladaya Joseph, I can cite you at Edo Blossom, Adidola Miracle, Semi Ufaidat, I cite you, Esther Mudupe. Thank you very much for staying with us till today, till now. Somebody is asking a question, sir. Coach CJ, are you still with us? Coach CJ, sir.
Yes, yes.
Yeah, someone is asking a question. Said, can infection bring back pain? Can infection bring back pain?
Okay, yes, yes. Certain infectious conditions can result to back pain, and this can be either directly or indirectly. An example that I would give is there's this infectious disease of the bone, that can also affect the spine. I think it's osteomyelitis, you know. So some infectious conditions can result to low back pain and also refer pain to the back. So yes, infection can cause low back pain. However, whatever process it is, I mean, whether infection or not infection, you have to be properly tested. So if it is an infectious, let's say, infectious inflammatory condition, certain biomarkers in the blood will be able to detect that there are certain things. Doing a full blood count, a complete blood count, a lab test, will be able to check if there are infectious processes that are going on in the bone cells or the blood cells, or maybe taking a sample or culture to go and examine in the lab. So that's it. Remember, I said this can be happening intermittently. I mean, it can be happening simultaneously. There could be this going on and another thing going on at the same time. So yeah, it can be, but you need to do a test to be able to rule out that there's an infectious process going on.
Okay, thank you very much, sir. NMSLIT. I hope that your question was answered. Thank you very much. Yeah, if you have any other question, you can drop, and then I'm giving us 1 second and 1 minute to drop our question if you still have questions before I close the program for the session for today. Okay, we'll wait for the question. Please kindly follow the link to this session. You can join the Coach CJ's YouTube, LinkedIn, and Facebook. Kindly follow him for more wonderful sessions. He talked about about posture. You can join using those links so that you can get the notification when you upload these videos. So oh, Samuel find that any so you said you've learned a new technique of holding your phone. Yeah, to prevent neck pain. I actually learned that too. When he was talking about poor posture, I had to be checking myself. Wait, hope I'm sitting properly. Yeah, I learned that too. And then tell a friend that your next posture is the best posture. Yes, your best posture is the most mobile posture. Tell a friend to tell a friend. Thank you very much for joining us. Thank you, IFUTSA, for this wonderful session. Thank you, President Ahmed Awal, for thinking of this. We really appreciate and we've learned a lot. Thank you very much, Coach CJ, for honoring our invitation. Let's all have a wonderful, wonderful, wonderful night rest.
Thank you all. Thank you all. Have an amazing night rest and um enjoy yourself. Do well to put all the things you've learned into practice. And thank you, my moderator, for being super amazing. It was fantastic working with you. Well done and good night. So I'm going to put background music for those who are here. In fact, I'm not even ah, where's my music box? Okay, so do have an amazing night rest and do have an amazing night rest and feel free to connect with me if you wish to reach out to me personally. Send a message on Facebook, YouTube, LinkedIn, whatever platform. You can just type my name on Google, type Chijoko Tiba, and you would see um almost all the platforms that exist when you type on Google. So have an amazing night rest. Bye everyone.